So we're not sure when many of our cases were infected, but I think we do know that in Australia now there are well over 50,000 men, mainly men and some women, who are carrying the virus, who in time carry a significant risk of developing AIDS.
In 1984, I was one of the first group of people to be diagnosed with HIV. So it was pretty devastating because back in those days, it was a death sentence.
St Vincent's was in the epicentre of where it was all happening, no question. And to a degree still is.
We were always behind the 8 ball, right? There were always too few beds and too many patients who were sick. The Sisters of Charity at the time were very brave to insist that patients should be cared for here according to the philosophy of the sisters in the provision of health care to people no matter how they became ill.
We had nothing to treat the virus with, so we could treat the complications, we could treat the symptoms that the patients were suffering to varying degrees, but we had nothing to reduce the virus.
It was rare for a person to have one problem. They all had 2 or 3 or 4 medical problems, and it made their care very complicated.
In those days, the word homosexual was unmentionable still, almost. People didn't talk about it. It was something that you didn't discuss. And so a lot of our patients had parents who they had to come to terms with the fact that their sons were dying and that their sons were gay.
I was terrified because of that attitude of people out in the general population. So coming in here, it was like a refuge, it was like a sanctuary.
And it meant a huge amount to our patients in that they'd been fearful of going to hospital. There were stories in the paper of their meals being left in the corridor, nurses not wanting to touch them. And finally there was a unit which was built on compassion.
Our attitude was non-judgmental. Our attitude was one of loving the person and no judgment, no condemnation.
So to have an organisation, St Vincent Hospital, the nuns, commit to this and establish such an excellent service, which the doctors and nurses were proud to work at, sends such an important message around the country for tolerance and understanding.
It was a very compassionate atmosphere, and they were very relaxed about visiting hours. I remember taking friends that were visiting from New Zealand into seeing dying friends at midnight. They didn't mind, it was cool.
One of the high points of the whole episode was the support that we had from the sisters and the hospital administration, as well as the governments of the day, and being able to set things up and get appropriate funding to look after these patients.
We met with the then Premier Neville Wran, and we received $2 million towards the establishment of the new immunology centre, and we had fundraising activities to raise money to expand that.
HIV research and ongoing treatment continues to be a priority for St Vincent's. We're doing some really exciting work in trialling new drugs, in post-exposure prophylactic treatment, but also looking at new and emerging treatments for people with HIV.